Now, we've already heard on today's show that any lockdown easing will be guided by the data. There are still thousands of cases and hundreds of deaths every day, but things do seem to be moving in the right direction. Now, as you can see, the number of daily cases is coming down. Fluctuations, of course, but the blue line, that's the rolling 7-day average, has clearly fallen from the peak around Christmas and New Year. So is the virus definitely receding? And what does it mean for easing restrictions? Well, we can ask Professor Tim Spector from King's College at London. Thank you very much for being with us. Now, your COVID symptom study app lets 4.5 million people report their symptoms, pretty comprehensive database. What is it showing in terms of the virus and how many cases there are currently?
Well, the Zoe app, as we call it colloquially, has been showing that since the 1st of January, cases have been falling across the country, and the R value has really been persistently below 1 during that time. And so we now have, we've dropped by about 80% since that time. So it currently means that we're at a similar state to where we were in October, and if we look at the trajectories of where we're going, in a couple of weeks, we're going to be where we were at the end of May, beginning of June, if people can remember that far back last year. So that means that we'll be below a prevalence, which is the number of people affected, have symptomatic COVID, of less than 1 in 500, which in my view means that we should be able to reduce some of these restrictions, and I'm particularly concerned that we get kids back to school as long as possible because of the known long-term negative effects of that. So the other consideration, of course, is what's going on in the NHS, and that's what people argue as a reason we shouldn't reduce these restrictions too quickly. And the data are showing, again, about a 60% drop in hospital admissions and about 50% drop in the percentage of people who are in hospital with COVID since the worst of this, which was about the second week of January. So
you mentioned,
all in all, it's looking quite good.
You mentioned schools there. We just spoke to Mark Drakeford. Obviously, in Wales, they are reopening primary schools at a quicker rate than in England. The Prime Minister said that he hopes to allow schools to reopen from the 8th of March. Do you think it should be done earlier than that then?
I think it's going to, if it was up to me, I would say there are some regions where it could be open up earlier, particularly in rural areas where they have very low rates of disease, and particularly if you focused on the low risk group, which is the youngest children who really pose very little risk to themselves or other people. So, but I think, to be honest, if we had a definite date of the 8th of March and we stuck to it, I think most parents around the country would be happy, because that would give them time to prepare as well, because what people don't like is having sudden switches in policy overnight, which can also cause problems.
Yes, definitely, when you're trying to kind of prepare home learning, and obviously the teachers as well, the logistics of it too. Professor Neil Ferguson told me this week that we could see low-level restrictions like face mask wearing at big public gatherings even into next year. Do you think that's true, or do you think we could see a complete return to normal earlier?
My belief is that it isn't a yes-no scenario. We're not going to suddenly wake up one day and say, we're all cured, like in the Hollywood movies, and wave flags. It's going to be a slow decrease out of this, where we're going to need to be cautious about new variants coming in, keeping an eye on how our vaccines are doing. And so it makes sense to be sensible for a while longer, whilst still keeping the vast majority of our social life and economic life and educational life going. So I've said before, I see a scenario, and it's not necessarily what I want, and I get criticized whenever I mention scenarios, as does Neil Ferguson, but I can see us carrying on using masks in certain situations. And why not have wash your hands when you go to the supermarket or you're touching food, These are things that other countries routinely do. If you look at Japan, they do wear masks every winter. And it may not be compulsory, it may be, but I think this is the sort of scenario we're going to see. But I'm also an optimist, and I believe that we're going to drive the levels of this virus really low. And the combination of also the vaccine success, and I wanted to come on and if we can talk about that a bit as well, because our app is also showing us some very good data on the vaccine.
What is the app showing on the vaccine then?
Well, so we've now got about 1/3 people who've logged their first dose of a vaccine with us on the Zoe app. And anyone who's listening, please, if you had a vaccine, do log with us. And we're showing very low levels of side effects. And we're showing that after 3 weeks, we're getting a 67% protection against the virus. So like 3 times less risk than you'd be getting otherwise compared to unprotected controls. So that's perhaps a better rate than people had thought just on a single jab. And so I think that combined with the data we're seeing gives me a lot of reason to be optimistic that we're going to be in a much better place in 2 to 4 weeks' time and can start to reduce some of these restrictions.
That's really encouraging. What kind of sample size is it for the vaccine data? Do you know?
Well, we've analysed about the first 50,000 people, so it's a large sample. And these are healthcare workers who are at high risk. So they're the ones you would see changes in most. And we're seeing a consistent fall, that no protection at all in the first 2 weeks. But and that's important for people to notice, because I think people rush out and think they're cured. There's high risk of infection then, and we are seeing lots of cases. But after 2 weeks, it drops to about 46%. And then 3 weeks to 6 weeks, it's 67%, which is really great. If that was around the country, then we'd have really knocked this virus on the head.
How do you work out the 67%?
We compare it to a group of control individuals who are healthcare workers of the same age and sex who have been logging with us and haven't had the vaccine. So it's not the same as a randomized trial. The data is not as clear cut, but it's a real life situation. And there's often people say that the trials sort of overestimate the benefits of vaccines. So this is the first large scale real-time data we have on this of a single jab. So it's still preliminary. We're still analyzing the results every week as people give us more data, but it's just to say that it's looking very promising, and that the government's approach of delaying the second shot in order to get more people vaccinated looks like it's paying off.
Now, you are able to report lots of different symptoms on your app. At the minute, though, many people are only eligible for a COVID test if you display a cough, a fever, or a loss of smell and taste. Now, my producers always say that I shouldn't use anything to do in my own life because it's anecdotal, but I recently had COVID and had none of those 3 symptoms, so wouldn't have been eligible for a test. Do you think the symptom range needs to be expanded? And is there evidence that with the new variants, we're seeing different symptoms?
Well, we've been saying since last spring that the range of symptoms should be expanded. And this has been clear from the people reporting on our app, where there are over 20 symptoms of COVID that are linked. And we've published papers and continue to do research showing the same thing's happening, is that 30% of people who have a positive PCR test, as perhaps you did, do not have those 3 classic symptoms. And this is particularly true in the first 3 days of the illness, when it's most infectious. So I understand why we didn't do this last spring, because we didn't have any testing and it would have crashed the system. Now we have a fantastic testing system, able to do over 600,000 tests a day. We do have the capacity to do it. This is the time to do that. And we would reduce infections by 30% in reality, because these people would be told to stay at home. And at the moment, it's a real risk that we are ignoring. And all these smoke screens of testing asymptomatic people is far less productive than getting to these people that actually have symptoms and are spreading the virus around. So absolutely. And I've forgotten your other question.
That was it, I think. That's all good. I did ask if the new variant leads to different symptoms.
It's interesting that the jury's out on this. The ONS survey, which is a similar size to us but very different methodology, showed that there was more evidence of headaches and fatigue and sort of sore throats, whereas our data, which has been consistent since the beginning, has shown no difference. So I think we don't know yet. I think we need to keep a close eye on it. But if everyone was more aware that, you know, the two common symptoms of early COVID are headache and fatigue and then you've got sore throat and sore muscles, then actually everyone would be safer. So I think it's a good debate to keep going on and keep looking at.
Mm. Now, you said recently that you don't watch the Number 10 news conferences anymore. Why not?
Well, I've overdone on COVID stats, I guess, and I also get a bit disheartened by the fact that we only focus on certain of those statistics. So the fact that not just the Number 10, but also the media focus on the number of deaths that day, and I think it's a very misleading statistic because I can't remember what the date. You know, it's very sad people die of anything. But for example, yesterday around 600 people died of COVID, but on a normal day in February, 1,500 people would die, mostly of heart disease, strokes, cancer, etc. So, or the flu. So we never put those statistics into any context. And I think this has got a lot of people extremely anxious and are petrified to leave their homes and may have real problems coming out again if we don't put these stats into some real perspective that, yes, rates are high, people are dying from COVID, but they also die from other things. Many of those people are not seeking help in the NHS. They are having mental health problems. They're not getting their cancer looked at, not looking after their heart, etc. So I just would like to see also perhaps less fear-mongering and more a general picture. And that's...
Oh, we've just lost you. We did get through most of that interview, though. Fascinating stuff. Professor Tim Spector there from King's, the founder of the Zoe app.